Thank you for watching my video tutorial. Today's topic is how to take proper skin fold measurements for assessing body composition, which is an integral component of physical fitness. Today we will focus specifically on the 7-site skin fold assessment, which is a reliable method of estimating body fat percentage by taking skin fold caliper measurements in 7 different locations on the body, and then applying the results onto one of the various formulas available. In order to get the best and consistent measurements, all skin fold measurements should be taken on the right side of the body and by the same person. Also, a minimum of 3 measurements should be taken and used to calculate the mean as your final result. However, one very important note is to rotate between sites to allow the skin to go back to its normal elasticity. So we'll begin to take actual proper measurements, remembering to take the measurements on the right side of the body. The equipment used to take proper measurement is a marker and a caliper. Also remember to pinch above or below the mark and not just pinch muscle nor just assessment skin. We'll go ahead and begin with the tricep, and this is going to be a vertical fold, and so we'll take the posterior midline of the upper arm from the acromion process of the shoulder to the acromion process of the elbow. We'll go ahead and go midline. We'll go ahead and take a pinch, and we'll go ahead and mark it. Okay, the second assessment is a chest assessment, and it's a diagonal fold, and basically we're going to take the distance between the anterior axillary line, which is under the armpit, and the nipple. We'll go halfway, go ahead and make sure to get a nice pinch, and we'll go ahead and mark it. Now for the women, it's very critical that we just do 1/3 of the distance, and that's how you take proper chest assessment. For our third assessment, this is called the subscapular assessment. It's very important that we go ahead and bring the patient's arm back. That way we can get good location of the inferior line. Once you go ahead and locate the proper location, go ahead and bring the patient's arm straight ahead and go ahead and get a nice marking. Now it's very also important if you're working with a woman that you go ahead and remove any clothing or at least move it up. That way you can take proper assessment. Also very important that you measure about 1 to 2 centimeters before below the inferior line, and again it is a diagonal fold. For the fourth assessment, called the mid axillary, we're going to go ahead and raise the patient's arm up. We're going to go ahead and locate the sternum and move across to the side of the torso. And basically we're going to go ahead and line up with the mid axillary line, and again we're going to take a nice chunk and go ahead and get a nice marking. And for the fifth assessment, the suprailiac, we're going to go ahead and take a diagonal fold, and we're going to go ahead and locate the anterior midline axillary line. Go ahead and go down to the crest, palpate the crest, and go ahead and take your skin fold and take a proper measurement. And for the sixth assessment, the abdominal, we're going to go ahead and go 2 centimeters from the umbilicus, and it's a vertical fold, and we'll go ahead and do a nice marking. And for the last assessment, the thigh assessment, basically the most important part about this assessment is that his left leg carries all his body weight, so the right leg can be nice and lean. Also, this is a vertical fold, and the way to measure is you want to go ahead and take the anterior midline of the thigh, which is from the hip to the patella bone. Go ahead and meet somewhere in the middle, get a nice skin fold, and take your marking. Now that it's actually time to take the actual assessment, now that we have proper markings, it's very critical that you go ahead and place the calipers 1 centimeter away from the thumb and index finger, and you go ahead and take a reading midline halfway point between the crest and the base, and we got a reading of 14. Okay, for the second assessment, again the chest, now that we have our proper marking, go ahead and get your skin fold, and we got 7. And for our third assessment, this is the subscapular. Remember, it's a diagonal fold. Locate your marking, go ahead and take a pinch, and take your reading 11. It's very important that you also remember not to take or not to have it pinching more than 2 seconds. Assessment, the suprailiac. Again, locate your marking that you've done previously. Go ahead and get your skin fold. No more than 2 seconds. And take your reading. We got 9. The thigh assessment, again, same thing. We're going to go ahead and locate our previously marked position. Go ahead and get your skin fold. And we got a reading of 11. That concludes taking a proper skinfold assessment for all 7 sites. The following equations are specific for gender as they use different metrics to calculate body density, using the sum of the 7 skinfold means as shown in the first 2 equations. Once that is calculated, the final number is used with the third equation shown that will calculate actual body fat percentage, and therefore you can compare the subject to norms for that gender and age group.